Hi everyone, this is Kim. Thank you so much for clicking on the video. Today I'm going to be talking about signs of a mini stroke that you should never ignore, especially if you have Parkinson's disease. I want to welcome you back to the channel. If you or a loved one has Parkinson's disease, there's something incredibly important you need to know. Mini strokes, also called TIAs, happen far more often than you might think. But here's the scary part. Many people mistake these warning signs for just another symptom of Parkinson's. This can be a deadly mistake because a mini stroke is often the first sign of a major stroke coming soon. Today I'm going to talk about what a mini stroke is and why it happens, how to tell the difference between a TIA and a Parkinson's symptom, the top warning signs you should never ignore, and what to do immediately if you suspect a TIA. This information could literally save the life of someone you love or you. So stick with me till the end. Okay, once again, I'm going to tell you that I am not a medical professional. I am not a doctor. I don't work in that field. I'm just a normal person who did a ton of research for my mom with Parkinson's, trying to help her deal with her symptoms and the disease. Okay, so what is a mini stroke, a TIA? TIA stands for transient ischemic attack. This happens when the blood flow to the brain is temporarily blocked. Unlike a full stroke, it doesn't cause permanent brain damage, but that does not mean it's harmless. A TIA is your body's way of warning you that a major stroke is likely coming soon. According to the American Stroke Association, about 1 in 3 people who experience a TIA will have a full-blown stroke within a year, and nearly half of those strokes happen within 48 hours. Now, here's where things get really concerning for people with Parkinson's. Research from the National Institute of Neurological Disorders and Stroke shows that up to 30% of Parkinson's patients have underlying vascular problems that make them more prone to TIAs. This means that if you or someone you love has Parkinson's, you need to be extra vigilant about recognizing the signs of a mini stroke. Now let's talk about how a mini stroke can mimic Parkinson's symptoms. This is where things get a little tricky because some of the symptoms of a mini stroke can look a lot like Parkinson's disease, but there are key differences you'll need to watch for. Some common TIA symptoms. Sudden numbness or weakness on the face, arm, or leg, especially just on one side of the body. Slurred speech or difficulty understanding words. Blurred or double vision. Severe dizziness or loss of balance. Sudden confusion or trouble concentrating. How is this different from Parkinson's? Well, Parkinson's tremors are gradual. A TIA symptom appears suddenly and out of nowhere. Speech problems in Parkinson's develop slowly. A TIA causes immediate slurring or gibberish. Parkinson's can cause balance issues, but a TIA might make someone suddenly collapse or become disoriented. Parkinson's disease typically affects both sides of the body, or one more severe than another, but there's some effects on both sides. Anyways, a TIA usually affects just one side. A good rule of thumb, if a symptom comes on fast and then disappears, it's likely a TIA and not Parkinson's. That leads us to the next crucial part, the FAST test. What is the FAST test? Well, it helps you decide if someone is having a stroke. So this is an easy way to check if someone's having a stroke. So F is face drooping. Ask them to smile. Does one side droop? A, next letter, arm weakness. Can they raise both arms evenly, or is one drifting down? S, the next letter, speech difficulty. Are their words slurred or strange? And the final one, T. If those 3 are yes, then it's time to call 911. Even if the symptoms go away. A TIA is a major warning sign of a future stroke. Now, the next thing we're going to talk about is what do you do if you suspect a TIA? obviously call 911 immediately. If you or someone you know experiences any of these symptoms, even for just a few minutes, don't ignore it. So you call 911. A TIA is a warning sign that a major stroke could be coming, so you want to take this seriously. Track symptoms. Write down exactly what happened and how long it lasted. Follow up with a doctor. The patient may need tests like an MRI or an ultrasound to find out exactly what's going on. In the emergency room, they should do a stroke evaluation. Make sure that you tell them that you think that the person had a mini stroke. It's important. Timing is of the essence. The final thing that you should do all the time, not just when you suspect a TIA, should be a lifestyle change. Manage blood pressure, cholesterol, and stay active. This can make a huge difference. So mini strokes are silent but deadly. Knowing the warning signs and acting fast can literally save a life. If you found this information helpful, hit that like button and share it with someone who needs to see it. Share it with everyone you know, especially the older population and anyone that has Parkinson's or has a loved one with Parkinson's. Anyways, thank you so much. Don't forget to subscribe to the channel so you don't miss out on future videos. Thanks for watching. Stay safe, stay informed, and take care. See you next time.